Welcome to MFP Live. I'm Donna, the co-host of this program and also the editor of the Mississippi Free Press. And I'm here as always with my co-host and the publisher of the Mississippi Free Press, Kimberly Griffin. Hello, Kimberly.
Hello.
And I think everybody watching this knows that this is a special edition of MFP Live with Dr. Thomas Dobbs. Hello, Dr. Dobbs. Thank you for being here.
Good afternoon. Thank you all for having me.
And, you know, what I wanted to say to folks is we planned this before today, but like a couple weeks ago, I think, but the timing could not be better or worse, perhaps, depending on how you look at it, considering the numbers today. I think folks watching this know that we had nearly 5,000 new cases in the last 3 days. All kinds of conversations and debates are going on over what to do about school safety as schools prepare, with some schools delaying and various things going on. So this is a very important conversation today, and we so appreciate your being here, Dr. Dobbs. We got so many questions, particularly in the last 48 hours, because I think that we were talking about before the show, the concerns about schools in particular are really on people's minds. So we appreciate you taking the time to do this.
No, it's my pleasure. It's a difficult time right now, without a doubt. We are in the midst of our fourth and most challenging wave, without a doubt. You know, we didn't really expect to be here going into the summer. Things were looking very promising. We had the Alpha variant that was circulating widely in May and June, and a combination of, you know, the number of folks who've been vaccinated, the number of people who had it before, and the degree of population immunity seemed to be sufficient to kind of keep us at steady state. But then combination of, you know, 4th of July festivities, and then really it's the Delta variant. It's all about the Delta variant. It's a new ball game. It's a different animal, and it's really just causing absolute, just very crazy difficulties in the state of Mississippi right now.
Right. And, you know, I was on social media over the weekend and Twitter, and got a little ornery from time to time, I have to admit. But, you know, there's just there are a lot of questions out there, but there's a lot of just kind of, I don't know, misinformation flying around, and particularly even focused in on the masking and in the schools. And so one of the things I feel like, because it's so prevalent for people right now, I should ask you is, you know, with the kid, with people going back to schools right now, and there are a lot of people saying that, well, there aren't enough kids being infected or not enough kids dying, which is a lot of what I was seeing in the last 48 hours on social media. So we shouldn't be requiring masks. Schools shouldn't, the state shouldn't. I feel like there's a lot of just misinformation in that right there about what's happening right now with the Delta variant. So could you talk about what's going on with children in specific?
So we learned a lot last year, and, you know, we had a pretty normal school year last year compared to a lot of states in our nation. I mean, it was different. There's no doubt about it, but we were able to maintain a large percentage of our kids in the classroom, in in-person learning environment. And we learned that in controlled settings, in a structured environment, when you have kids separated by a minimum of 3 feet and they're wearing a mask, and you're being conscientious about, you know, who's infected and making sure you get them out of there and go home until they're better, that you do pretty well. And we see very little transmission in the classroom. Now, we did have a lot of challenges in the sporting events and kids on buses going to the, you know, games or band or whatever. And the parent-sponsored social activities actually were the biggest challenge, because we had a few pool parties that would take down the whole school as far as being able to operate. But right now what we're having is a combination of a variant that's 3 times more contagious than what we're dealing with last year. And we have a public that's increasingly reticent to take on the preventive measures. And, you know, I can't make reality any different than it is, but you can't have that combination of factors and throw in the fact that probably only 1/3 of our kids are immune, either from previous infection and vaccination, it's just really it's an explosive recipe for disease transmission. I think it's going to be very challenging. I think if we look at what happened in the Lamar County schools, I think it's very demonstrative of what we're going to see. It's just really a nature of the biology of the Delta variant. It's just so very contagious. Unless we are absolutely fastidious, we're just really focused on every safety measure to make sure our kids can have a good in-person learning environment. We're going to have kids out of school all the time, and it's just going to be that way for a while.
Well, and I saw some very specific, for one thing, there was a graphic that I think came from y'all's website that showed the numbers of new cases that are young people. Like, if you could share a couple of numbers with us to just kind of set the table on that.
Most of the cases we're seeing right now are in younger age groups. And one of the things you may have seen was the hospitalizations. And you can see the fastest growing number of hospitalizations are in people under 50. We've got a lot of people in the ICU, 20s, 30s, 40s. It's a very disturbing trend. That's one thing. But we are starting to see increasing transmission in young adults. Not quite so much in children. It's been pretty steady increasing, but we do anticipate when kids are going to get back into school, that we're going to see a lot more of that. And we'll be monitoring that very closely, similar like we've seen with young adults. But it's pretty inevitable that we're going to see a lot more cases in young kids.
And one final just data point, and then I'm going to kick it over to Kimberly. You had also tweeted that the Delta variant is just so much more infectious. So what was the number you were using, that correct me if I'm wrong, but each person can affect 8 or 9 people, and that's different than before. Can you address that a little bit?
Yeah, and that's that R0 thing that people talk about, which is the infectiousness of the virus. And that was within that sort of CDC released information last week, where it looks like every person who has COVID on average can spread it to 8 to 9 additional people. And you can see, if you run that through several different cycles, you can see, 1 goes to 8, goes to 64, or, kind of ad infinitum, it'll spread really, really quickly. The other challenge is we see without a doubt that the Delta variant, people go from exposed to contagious within about 2 days compared to 4 days with the other one. So you don't really have as much time to intervene. So it kind of gets away from you more quickly. It's just a natural fact of the nature of this Delta variant. It's just so contagious. You're just really got to be that much more cautious in your approach to it.
So we all woke up, I guess Thursday or Friday, to really tough information that you referenced about the Delta variant, which for my generation, and I guess everyone's generation on this call, is the chicken pox. Like, when we hear that, we know what that feels like, what that looks like, what that spread looks like. Can you clarify the quarantine isolation protocols for vaccinated people who've been diagnosed with COVID? It sounds like the viral load's about the same. We're still working remotely, but we're wondering if workplaces may be telling folks who have light cases to come in. Tell us what the best practices are.
And one of the things that the terminology we use is a little bit different. And so I think sometimes that's confusing. If someone is actively infected, we call that isolation. And so if you're actively infected, we say isolation, and isolation for any infected person should be for 10 days at least. That's assuming they're recovered at that 10-day period, whether you're vaccinated or not, because you can be contagious. What we have seen is that people who are vaccinated and get COVID, there's a couple of different scenarios. A common one is they may become contagious and not know it. Because, vaccines mostly protect you from getting sick. It doesn't always prevent you from having some virus replication in your nose until your body can get rid of it. Because your immune system has to be sort of like woken up to say, hey, it's back, let's get rid of it. And that's kind of what's happening. It looks like probably the current vaccines are about 2/3 effective in keeping you from developing any viral production, and about 93% from getting severely ill. So that's going to be a little bit of the difference. But I think this slide is very important to see that even though, are some vaccinated people going to become ill? yes. Are they going to be less ill? Absolutely, on average. But without a doubt, the vast majority of transmission that is being perpetuated in Mississippi is from folks in the normal unvaccinated group of people. We're also seeing a good number of cases in prior cases. So people who had COVID before are getting the Delta variant, and then can spread it again too. So, but since you brought this up, I do want to reiterate that the COVID vaccine is still pretty darn good against Delta variant. It's just not quite as good as it was before, with estimates of 88% effective at preventing any symptomatic illness. But what we've seen is the illness that people do have, by and large, is much less severe with the Delta variant than otherwise.
And should vaccinated people avoid crowded spaces, even if they're wearing masks? The guidance is confusing because we've gone back and forth. The CDC has changed some direction, as you do when you find out more information with science. What about outdoor crowds? What are best practices in those cases?
Yeah, so I think if we can think about what we need to do, what we can do that's reasonable to prevent COVID transmission, and what's reasonable to do that's not overly restrictive. Doing things outdoors instead of inside. Outdoor transmission is very uncommon. It can happen, but having super spreader events outdoors is going to be very, very rare. So do it outdoors. Certainly, we recommend indoor masking for if you're in the public. So everyone needs to wear a mask. Mostly it's going to be beneficial for people who are unvaccinated, but there's an additional benefit for people who've been vaccinated because they might fall into that less common sort of slice of folks. We and me personally recommend avoiding any mass indoor social gathering. If we look at what happened in Massachusetts, and that's a whole different sort of story that's very interesting, because if you look at what happened there, it was thousands of people who were crowded into bars and restaurants unmasked. And, a lot of people did get it who were vaccinated, but it was estimated that 90% of people who were there were vaccinated. So the per capita risk was actually a lot higher for the unvaccinated, but because the majority, 90% or so of folks in that area were vaccinated, of course, you're going to have a pretty big slice of those folks who are going to have it, although their infection is going to be a lot milder. And you can see this is from the Kaiser Family Foundation analysis, and it's a good article for people who want to read about what does it mean for you if you've been vaccinated and COVID. It's pretty demonstrative that it's still vaccination is our best way to slow down the pandemic, to be done with it, but also to save lives and keep people from being hospitalized.
To kind of build off of that, because you're talking about outdoor spaces, and and I know it's safer, but then we think about these events, like everybody was showing all the pictures of the Lollapalooza this weekend. People like this in the Shelby County Fair. I understand Trace Adkins was there, and 10,000 people, and they're elbow to elbow, and and I grew up going to the fair. I know how it can be, and we're hearing reports that there was perhaps an outbreak in the Shelby County Fair. We haven't confirmed that. I don't know if there's something you can say about that, but what about events like that are outdoors, but they're also indoors, and it's just this really kind of crowded cauldron of stuff? I mean, should people be wearing masks in those cases?
Boy, people really just don't need to be putting themselves in that situation, honestly. What we see is, what worries me more about Neshoba is not the concert as much as it is 30 people sleeping in a cabin overnight, right? I mean, and this is the challenge about masks. And I think this is one of the reasons why masks kind of if I had to choose between masks and social gatherings, I would say avoid social gatherings. I'd say, I think a mask is a useful adjunct, don't get me wrong, but people catch COVID in situations where they wouldn't wear a mask. People catch COVID when they're at a wedding and they're dancing. They catch COVID when they're at a funeral and they're hugging somebody. And you might wear a mask at a funeral, but if you're hugging somebody and you're crying over each other, that's a high transmission risk. It's when you're having a big family dinner with people. So these indoor things are really going to be the main thing. I mean, I wouldn't go to I don't want to do it anyway. I guess I'm too old for that sort of thing. But I did go to the first Lollapalooza. That might tell you how old I am. But I don't think it's a good idea. But it's really the indoor stuff that's driving it. And I think even for Neshoba, there'll be definitely transmission events linked back to that. It's the indoor stuff. We mostly give COVID to the people that we know and the people that we love. That's where COVID goes. And if we think about the vaccine and COVID, I think it sounds a little bit like a hard reality, but it's reality. One of the reasons it's important to get the vaccine is obviously you want to protect yourself from getting sick. And we see a lot of younger folks who are in the ICU right now who are not going to make it from COVID, who need to get the vaccine. But it's not just you. If you get COVID, it's that maybe 8 or 9 people you're going to give it to. And those people you're going to give to are your family and your friends that you don't want to give COVID to. And so one of the most important reasons for me to be vaccinated is because I want to protect my family from getting it from me. My dad, who has a weakened immune system, that sort of thing. So, yeah, this is very important to see how highly effective the vaccine is at preventing death. And you can see almost all of our deaths, and this is for the past 7 months, are in not vaccinated folks, but we haven't had any deaths in vaccinated folks under 50 and very few in the 50 to 64 range. So we know that the vaccines are hugely effective, especially for teenagers. We know that teenagers respond robustly. I mean, for the previous strains, it was about 100% effective, and it's going to be even better. For the Delta, it's going to be a lot better for teenagers than it would be for older folks.
And then what about flying at this moment? I just came back from my first flight since the pandemic started. That was nerve-wracking to me, but it was okay. I got through it. But then, should we be flying right now while everything seems to be exploding in this fourth wave? Is it safe? What's your take on that?
Everything's risk reduction. And, if it's not something that's absolutely necessary, it's probably good to put it off. But there's something you might have to do. It may well be that your aunt broke her hip or something, and you just have to do that. But I'll tell you, I'm more worried about being in the airport than being in the airplane. The airplanes actually have pretty phenomenal circulation, and we see this with other scenarios like measles or tuberculosis. We see very little transmission within the airplane because the way the circulation is. I'm not saying it doesn't happen, but it's pretty good. And if you're wearing a mask and you have that good circulation, certainly I would wear a good quality mask, probably a medical grade mask if I'm flying. But it's the chilies and the TGI Fridays in the airport that scares me to death. So, avoid those indoor spaces where you're breathing other people's air.
All right, this next one is from a reader, and the reader says, for those of us with compromised immune systems, immuno and auto, will there be an implementation of boosters of the COVID vaccine for those who need them? Currently, this appears to be on a state-by-state basis.
So this is a real challenge because and we've been in a lot of conversations with our federal colleagues, especially at the CDC. It has an EUA for the vaccine, and there is there's potential limitations on using it outside of that EUA. I know this is kind of technical, but we can't get clearance to use it from a health department perspective on a routine basis. But what we have done is we tried to make sure, and we've released information, that certain subgroups of folks who are immunocompromised, especially cancer patients, transplant patients, people on medicines that make their immune system weak, are very likely to benefit from an additional dose. And we've seen this in studies. We know that Israel's doing this. And so we encourage docs to sit down with their patients and have a one-on-one risk-benefit conversation like we do with so many other medical issues. And we've seen quite a few physicians provide these booster vaccines for their patients. And that's really where the conversation needs to happen right now. We're supportive of that physician-patient conversation to try to make the best decision for them. And when we do get clearance to do it from CDC, we were going to make it available in every single county health department across the state of Mississippi.
Great news. We are masked. This is from a reader. We are masked and vaxxed. Hubby still works with unmasked soon-to-be caretaker of a newborn grandchild. How do I keep him safe?
Boy, is the soon-to-be caretaker vaccinated too? I mean, if that it helps when you have vaccinated people around each other. There's always going to be some risk. Anything you can do, it's always risk mitigation. There's never risk elimination. And if you can layer your risk reduction strategies, you're going to be in better shape. Wearing your own mask, um, I'm very confident that people who want to protect themselves, if you wear a medical grade mask that has the properties that are used in hospitals to prevent transmission, it is protective for you as a person. And so that's what is worth doing for sure. But also good air circulation, making sure, and then that you have, good airflow outdoors, open the windows, although it's pretty darn hot right now. And then space and physical distancing. All those things are going to make it safer for you, but everything you can do to make sure that your cohort is vaccinated is good. I mean, I'm vaccinated, my nuclear family's vaccinated, all of our nuclear families are vaccinated. These layers of protection make us all that much safer.
All right. This is not actually a reader question. Does the Delta variant have different characteristics of airborne or droplet transmission than previous strains? Is it enough to have a good mask? I think you've answered that question. When you're around people, I think you've answered this question, or should you keep it on when they cleared the room? You may not have answered that second part.
Yeah, so I think without a doubt, we have seen that COVID, our traditional COVID that we saw last year, under the right circumstances, is airborne, meaning it spreads and fills the room, right? And so it's not an either or. I think it's an and sometimes. And with the Delta variant being that much more prolific in its reproductive mechanism, the viral levels in somebody with Delta are 1,000 times higher than what we've seen previously. That the transfer being airborne transmission is much higher. And so I do absolutely think that that's happening with greater frequency. Is there potential for it being in a room for a period of time after someone leaves? Yeah, I think definitely, just like other viruses. So airflow, air clearance is so critically important. And yes, probably would wear a mask for a period of time. That's going to depend on how many air turnovers you have in the room. But for that sort of situation, airflow is critically important.
And this is a follow-up, and then I'll turn it over to Donna. This is a follow-up. I have been seeing anecdotally pediatricians that I trust talk about they're seeing some long-term effects with kids after they've had COVID. Pediatricians are reminding people that parents should be aware of certain symptoms they see after COVID. What are you hearing? What are you seeing?
Yeah, so COVID is bad for you. It's not like getting a cold and getting over it. There are going to be a lot of long-term complications that we're going to see from this. There are some studies that show like maybe 20% of kids have long COVID type symptoms. We know it causes brain inflammation and causes some different sort of things that can have some cognitive impact, especially, long COVID, a lot of it's sort of like forgetfulness, memory issues, fogginess, that sort of thing. But there are other things too. There is a growing body of evidence that shows what can happen to your reproductive system from COVID infection. We're seeing evidence of potential destructive changes in male testicles and reproductive health in that regard from the infection, right? And
Wow.
for women, increased risk of preeclampsia, and that threatens the pregnancy and the health of the mom. Even if you've had COVID before, not recently, increases your risk of preeclampsia. So COVID is bad for you. Please don't buy into some of the information out there that COVID's, if everybody gets over it. I mean, most people don't die from it. Amen. That's wonderful. But a lot of people who survive are going to have some long-term sequelae from it. So don't get COVID. I don't want anybody in my family to get COVID. I'm scared of COVID, and I'm worried about the I'm really worried about the effects that it play in my family. COVID's bad for you.
Sorry about that. I'm over here clicking through windows looking for my next question. I'm sorry. So somebody had asked, and I think this was a reader question as well, although I will admit to you, Dr. Dobbs, that there may be a Nick and Ashton questions scattered through here from time to time. You might recognize them. But a reader wants to know if MDHS is going to make Mississippi State Department of Health, that's written here wrong, y'all's organization is going to make recommendations for higher ed like you have done for K-12. And this reader said, we're going back full in-person with no protections. Will you specifically recommend that college and universities require masks?
Yes, absolutely. And we have a draft guidance for higher education that will be out probably by the morning. We're just going through some of it with different leaders to make sure there's no concerns. We're absolutely going to recommend universal masking in colleges and universities, just like we do for any other indoor gathering. We're also going to have some guidance about how to do isolation and quarantine and how to respond to outbreaks. It's going to be a challenging school year for colleges and universities. Again, I do want to reiterate that just like our high schoolers, the majority of kids who are going to college are not immune, and they're going to be susceptible to Delta, and Delta is way more contagious than what we had last year. So I'll say that the colleges and universities that we've been working with have been incredibly responsive and really engaging and trying to make sure that their students have a productive year. Understanding that they're college kids and they need to have a little bit of fun too, but we're going to try to help them do it as safe as possible.
And then a follow-up here, this may be a different reader, but it's kind of in the same line, that state universities have sent out emails saying they were working closely with IHL and MSDH, but still haven't even gone back to indoor masking yet. Are they not getting guidance on this, or is this a failure at the level of the schools themselves or IHL?
Well, I mean, CDC already said universal masking, so I think that's kind of a slam dunk. That's what that's federal guidance is, and then we've been waiting on CDC specific IHL guidance that has not come to fruition yet. So we're going to go ahead and release ours. We're kind of hoping to align it with theirs. I think it would be aligned anyway based on the principles, but we'll make sure that they have our full complement of guidelines. And I would say by the morning, if not this evening, they'll have that final product.
Great. Next question about education in schools. I think you've answered part of it, but maybe we need some clarification. Is the recommendation for universal masking in K through 12 meant for the entire school year, or is it short term? Would a plan, someone is typing my document in, for universal masking make more sense? And optional they're wondering, are some people doing like, we're going to mask until Labor Day, and then maybe we'll have some optional masking afterwards?
Yeah, no, that's an extremely good question. I would say that this is a for now sort of thing. We definitely recommend universal masking in the K-12 environment for now. Delta is going to rip through us pretty aggressively. I'm just going to be honest about it. But hopefully it'll be done, within a couple months. I'm not saying a couple of weeks, a couple of months, right? We've got a lot of headwinds ahead of us. And, my fear is that we're going to achieve herd immunity the hard way, right? We're going to have a lot of people get Delta variant, and then they're going to be immune to it, but because they had to go through it the hard way. It's much better to get it through, the really safe and effective vaccine. But I would hope that masks guidance of this measure would be short term.
Follow up from a reader: should high schools consider holding off on large athletic events and practice for a few weeks to allow for kids to get into the classroom and things to settle down? Or have sports been going on? I don't know how you would know this question. You may know, this whole summer without outbreaks or concerns?
No, we had a lot of outbreaks, without a doubt, over the summer. Again, it's a matter of indoor, outdoor, and being conscientious with excluding infected folks. We have run into considerable pushback on anything that would delay or limit high school athletics. We have clearly recognized that that is a priority for many Mississippi schools and parents and kids. So really, just to do it as safely as possible. But if you're a parent and you're worried about your kid, don't let them participate. I mean, COVID's not forever, and the Delta wave's not forever. It's just better outdoors. Be careful inside and in buses.
So, here you're talking about the pressure, and we all know this, that it's just this kind of crazy division out there right now. One of our reader questions was, what would you say to a student or teacher, or I would add anyone, who feels peer pressure not to mask, since doing so would make them a visible minority?
Yeah, no, that's pretty tough. That's one of the reasons I think why universal masking is such a good idea. If you sort of, it's kind of like, that's why we have school uniforms sometimes, right? I mean, we have standards, and that makes a lot of sense. But sometimes doing the right thing is the hard thing. And if you don't want to take COVID back to your mom and your grandma, and maybe your grandma has immunocompromised condition, or maybe she didn't respond to the vaccine, and you don't want to take COVID back to her. It's the loving thing to do, is to protect yourself, to protect others. And it's also motivated self-interest to protect yourself, because COVID's bad for you.
And let's stay with this for just a minute. Like, I guess I want to ask you, whether it's masking or vaccinations, you've been doing this for a while. And by the way, thank you for your service since this started, because wow. And you're kind of in that hot seat where I would guess that it can be hard to sleep sometimes thinking about what can happen. What have you seen work, as far as, like, what are some of the victories on reaching people that you have seen or are aware of that made them go, oh, wow, I need to think about doing this a different way?
So, it's different for different folks, and different parts of our population. I want to give just a remarkable shout out to our Black faith leaders, who have done a phenomenal job. I think that by and large across the state of Mississippi, African American communities recognize the threat of COVID. Now, we still don't have enough folks protected with the vaccine, but if we look at the transmission that's going on, since the early part of the pandemic, this has switched to a disproportionately predominantly white disease in Mississippi. Now, still a lot of Black folks are getting affected, don't get me wrong, and we've got a lot more work to do. But I think a lot of it has to do with people in the Black community standing up and saying, this is not okay. We need to make sure, first people masked and separated, and still a lot of the Black churches are still doing virtual, and I think are going back to virtual. I have had a lot of good conversations with National Baptist Convention, and they're very attuned to it. But it also speaks to Black physicians, a lot of the political leaders, and just community leaders, mayors have stepped up and have done absolutely phenomenal job communicating with their constituents. I think that's been a real success. The other successes we've seen have been with physicians who are willing to sit down and talk to their patients and answer questions. Social media has just scared the mess out of people. It's a lot easier to introduce a fear than to replace it with the truth. And this sort of noxious social media environment is poisoned our minds to some degree, and some of the cable news stuff is mind poison as well. But it takes a lot to take that out, and I think having those questions and concerns and sitting down with a thoughtful, caring physician who's worked with you and your family for years makes all the difference. And the same thing with I'm gonna tell you, we're sadly seeing, like last week, I was visiting a hospital and they had a woman who had to deliver a baby at like early 30s. I think the baby's okay, but the woman died from COVID. We know that pregnant women do much worse with COVID, and we know that the preeclampsia rate is looking really bad for women with COVID. So COVID's bad for you. So talking to your docs is one of the most important conversations you can have.
We had a question on Facebook that I don't see right now, but it was talking about indoor worship, which is one of the things. I know lots of African American churches have just not been back to church. They're just doing online, which is devastating for your mental health, especially if you live alone. And church was kind of the core of who you were. The question was, what are your thoughts about indoor worship services? I know my church went back, and then I haven't been back since we went back. I went one time. And we have a responsible faith community that is asking everyone to mask. But how do you do that balance of, especially the disconnection for so many people?
For one thing, I think it's absolutely critical to have online versions for people to have that as an option, right? And a lot of people really enjoy it. My aunt actually loves it. She can stay in her pajamas and pull up her Bible, and she can sit in her recliner, and she loves it. But it's always risk reduction, right? And the safest thing is going to be at home. I get that. But for people who need to be back in person, there are safer ways to do it. I can't say it's perfectly safe, but safer in the sense that, if people are masked and they're separated and they're not sort of, congregating in sort of tight groups after the service is over, have good airflow. You got to be careful about the choirs singing on folks, because that's a real good way to spread it. It can be done pretty safely. So I think it's a matter of taking those steps. But I will say that right now, especially, we are advising people who are older or have significant underlying medical issues to probably stay home for now. It's just too high risk, because it's one thing to get COVID. It's another thing to die from COVID. And we don't want our most vulnerable folks catching COVID.
We do have a question from one of our team, Nick Juden. He says, I see a lot of people spreading a lot of misinformation and fear over the experimental vaccines, but the virus is far more experimental, isn't it? Viral resurgence can often harm individuals years later, correct? Question mark.
Yeah, it really might. There's a lot that we don't know about what it's going to be. Like Ebola virus, remember, we thought that was an acute thing, and now we're seeing people who it erupts years later. And I'm not saying that's going to happen, but we do see evidence of sort of persistent viral viability in testicular tissue in a recent urological journal. So, yeah, COVID is really bad for you. There has really been no vaccine more studied than these COVID vaccines. And we have found some rare bad things that have happened with the Johnson & Johnson vaccine, specifically with the cerebral blood clots and the Guillain-Barré syndrome. It's fortunately very rare, but it's also reassuring that even these very rare things that happen on maybe a few per million sort of frequency, that we're able to tease that out. And we haven't seen that with the mRNA vaccines. I think clearly we know that the mRNA vaccines are more effective and don't have those rare but serious side effects, which is reassuring. But I think it's easy for some really bad misinformation to get out there and scare people terribly. They haven't really killed hardly anybody, the vaccines, except for these rare sort of things. And of the over 1.2 million people have gotten the COVID vaccine in Mississippi, and we're not aware of a one who's died from the vaccine. We get these little reports here and there. And of course, if you vaccinate, half the population, and a lot of them are older, somebody's going to have a heart attack or a stroke a week or two later. And when we've investigated them, they've had nothing to do with the vaccine. It was just a random sort of co-occurrence within some temporal proximity of vaccination.
And it's interesting because it's COVID, we hear about these things associated with the vaccine, but there are things associated with a lot of our vaccines, or maybe not. There are these 1 in a million things that are listed in the very small print of the insert of the medicine bottle that you get that no one reads. It's just, this has a light shining on it.
Yeah, and and certainly there are some common side effects. I mean, it does make people feel a little bit your arm sore and maybe a little bit achy for a day or two. I mean, we know all that, and we've seen it. But these perform very well. people can be allergic to anything, just about, right? And so we're going to see some of that. But one of the docs said he had a real good way he talked to his patients about it, and he said, look, we know you can have allergies to anything, but if you have an allergic reaction, we know how to treat that, and we'll take care of it. And that's what we're here for. We're here to take care of you. But if you get COVID and you get seriously ill, there's not that much we can do about it except for to try to help you, get through it. There are some treatments, there's no doubt. But if we look at the data, we know that about 7 to 8% of COVID patients end up in the hospital, of the ones that are diagnosed. And of that number that go to the hospital, about 14 to 15% will die. That's a huge mortality rate. And if you make it to the ICU, it's over a third are going to die. That's horrible.
Wow.
We want to prevent people from getting to that stage. It's not uncommon.
So I want to talk a little bit more about schools. Over the weekend, one of the things that a lot of people were talking about in different places, but particularly Oxford, it seemed like it was emerging, are some kind of prominent people doing these parental rights petitions. And the right is to keep the school or the district from requiring masks. And I know you've heard about these. And so obviously, in Oxford, a lot of Oxford parents that we know are really upset at those people because they're trying to stop a mandate. And some other states have actually said that schools can't require masks in individual districts, right? So I just wonder what you have to say about that as it's presented as a parental rights issue.
We always have to behave in a way that protects others in public. You can't drink and drive. You have to wear a seatbelt. You can't shoot firearms in the city limits. I mean, there are things that you have to be cautious of when what you perceive as your individual rights are harmful to others. The mask thing has become more symbolic, I think, than real, because it's just not that much of an impediment for someone to have a piece of cloth over their face. It seems like it's the parents that mind more than the kids. If we want to keep our kids in school and learning, then we need to do the things that are going to keep them safe from something bad happening. We're not going to let our kids, do something reckless in school. We want to protect them, and one of the best ways we can protect them is do these simple things that we know that work. I think it's a little bit misguided. We're missing our priorities. The priority should be to educate our kids and educate them safely. And this is a very simple step that adds a layer of protection to that. But this is sort of like the debate of our century.
Right. And staying with schools, we had a couple reader questions here that I kind of liked because, first of all, they showed just that parents are just scared to death and they're trying to figure out what is safe right now. They're frantic. But they're kind of speed round questions, and so as I would call them. So I'll ask you the first one here. I'm just reading the way they said it. Good idea or bad idea for the first quarter of the new school year? 1, full lunchrooms. 2, school assemblies, pep rallies, dances. 3, band choir.
Yeah. 1 can be a bad idea. You really need to space folks out. 2, a very bad idea. 3, can be done safely under certain circumstances. Band outdoors, that's probably pretty safe. But a packed choir is a really bad idea.
Okay. And you're saying school assemblies instead is a bad idea?
Yeah, I don't think it. If I think about my school assemblies when I was a kid, that's not a good idea. Yeah.
Right. And then their second one is useful or not useful for the coming school year. Desk/face shields, temperature checks, I guess, neurotic surface cleaning, which, we've all done, and excessive hand washing.
Desk and face shields are probably somewhat useful. Less so than a mask, but you're going to kind of contain it within the local sort of area, although it's not like it's hermetically sealed, right? Temperature checks are probably not that useful. Honestly, I don't think we exclude that many folks. Symptom checks are probably more important. Because a lot of kids are not febrile when they're contagious. Surface cleaning and hand washing, that's become a little bit. What drives me crazy is when people make up for not wearing masks by doing more hand washing. Most of it is going to be from breathing people's air. So do we want good hand hygiene? Yeah, we do. I think, a little bit of hand sanitizer in there makes a lot of sense, but it's mostly breathing other people's air is where we're transmitting COVID.
Our next section from readers is about hospitals and general medical staffing and things surrounding that. The governor, and this is from a reader, the governor used to emphasize the importance of keeping the hospitals from getting overwhelmed, but it's happening again and we're not hearing as much about it. How are you working with the governor to take action to increase vaccinations and reduce the spread?
Yeah, I know the governor is supportive of vaccinations, and I know he's made some, statements about it, and certainly glad to have his support. We need pretty much every Mississippian immune, and the vaccination is going to be the best way to get there, without a doubt. As far as the hospital situation, it's pretty dire. I have to confess, it's as bad as it's ever been right
Wow.
this very moment, and it's getting worse quickly.
Mhm.
Our challenge is that it's already bad, but our staffing is more challenged. We have a lot less nurses. The only good thing is we have adequate PPE, which we didn't have in the first wave, and certainly that's a big relief. But it's really bad, y'all. And so I just really encourage everybody to be safe. I mean, not just from COVID, but from other stuff too. Don't get in a car wreck. Don't fall off a ladder, because I just don't know that you're going to get the care that you think you're entitled to. And if you go in the hospital, um, have people help you get stuff done, because we're putting nurses at really highly and very concerning nurse to patient ratios, but out of desperation. Healthcare is an expendable resource. I mean, we can overtax the system, and we have. And it's almost like it's a self-fulfilling prophecy, because we're burning out these nurses, and they're saying, "I've had enough of this. I'm leaving. I can't believe you're putting me through this again." I've heard that over and over again. And we knew this was going to happen. It's actually worse than I thought it would be this fast. The Delta wave has hit us about. I really thought we'd be at about 1,000 to 1,200 cases a day, and we're getting closer to 2,000. Remember that for every 1,000 cases that we have, that's another 80 patients who are going in the hospital every day on top of an already full system. And once you get a sick COVID patient in ICU, they're going to be there for a month or two, often, if they don't die. So it's a slow recovery. It just stacks up fast.
You said recently that Mississippi has 2,000 fewer nurses over the past 7 months.
Mm-hmm.
And, we're a place that turns out good nurses at a pretty good clip. We got people coming in from community colleges. We got people get BSNs. Why? I think you alluded to this, but what are you hearing? And what are they removing themselves from the workplace and going home? Are they, because they've got people to take care of? Are they deciding to do some other kind of work as a nurse? Do you see that trend continuing? What can we do to reverse it? And you've talked about the impact, obviously.
I think there's a lot of those different factors involved. I think a lot of nurses, nursing has always been sort of like an expandable career. Sometimes people come and go from the employment pool, and I think that's part of it. Part of it is moving out of state. Part of it's retiring. Part of it is people moving from inpatient to outpatient. It's exhausting taking care of dying patients all day long in an overburdened hospital, and you may rather go work in an urgent care clinic or surgery center. And so when we're seeing that sort of transition. I mean, that doesn't get within that number, but we are talking with the Board of Nursing and the Nursing Association and other groups, trying to see what we can do to support nursing workforce. This is a problem that transcends COVID. We are understaffed in nurses and have been for a long time. It's just that much worse right now, and the timing is bad.
So, Dr. Dobbs, here's another reader question. To what degree can the health department launch a public information campaign to ensure that people know vaccines are free, where to get them, et cetera, via PSAs, text messages, billboards, and any other means? And is there a plan to launch such a campaign?
We have been doing stuff, and a lot of it's been sort of social media, and other sort of direct communications. A lot of our stuff has been going through partners too, that you might not realize that we're part of that conversation. Um, I do think that access can be an issue for some people, but I don't think access is but this tiniest sliver of the issue. Um, you can hardly walk through Kroger without them saying, "Please come get vaccinated," or Walgreens or
Mhm.
wherever.
Right.
We'll bring it to your house. We have pop-up clinics. We go to communities and are asking people if they want to get vaccinated, and they say no. Um, I don't think it's an
Wow.
access issue, and I think it's a different issue of trust that unfortunately has been undermined, for so many in our population. And that's really where a lot of our focus has been, is trying to make sure that people have trust, or they have mechanisms to reach that. Um, uh, Access is really broad, and um, uh, but anyway, we have been doing a lot of stuff, and there's more stuff on the way.
So that makes me think, I'm curious what your advice would be to the media, and I don't necessarily mean the crazy media to say the crazy media just stop being crazy, and I
Mhm.
mean that seems obvious, but the rest of us who, what else can we do?
You know, I think this is a natural fit, but tell making sure that the stories are there, that people will understand. Um, that if you have a heart attack, you might not get taken care of in a hospital, or there might not be an ambulance for you there. That your local community hospital is not there for you now because we have overwhelmed the system with COVID. Of the pregnant woman who dies because she didn't get vaccinated. I do see these stories from around the country, of young folks who didn't get vaccinated, and now they wish they had. I think it'd be good to see more of that from Mississippi.
Mhm.
Getting those folks to speak out, because this COVID surge that we're living through was not inevitable, and it was not necessary. Were we going to see a rise in COVID from Delta variants? Of course we were. It's a more contagious variant, but it wouldn't look like it looks here. I'm talking to my son on a regular basis about what's going on, and he lives in Washington, D.C., and he's like, "I can't believe that y'all are having to go through this. Life in D.C. is just so normal. It's just not like that. We're not having." And he's a med student, and he knows what's going on in the hospitals there. It's just a different environment. We have allowed lies and disinformation to fool us. We
Mhm.
have allowed the loud voices of disinformation to sow the seeds of distrust. Um, you know, uh, I'm gonna tell you, at the health department, we don't, we're not going to mandate any universal mask thing. We're not going to mandate, um, you know, go to your house and give you a COVID vaccine. The things that people say are phenomenal. Our sort of scope of control is really primarily over things which we have sort of regulatory statutory authority, and we're not going to be doing anything wild. It's something we need to do collectively. But that's something that we've lost. We've lost a collective spirit to do things for one another, and it's really disheartening to see that, um, you know, the greatest generation stormed Normandy, and was willing to sacrifice themselves for that, and we've lost more people in from COVID than we have from World War II, and we're not even willing to wear a mask or get a
Wow.
shot or stay
Mm.
away from a crowded bar.
Mm.
It's pretty simple asks. Um, but anyway, it is discouraging. But I just think we're having policy debates based on mistruths, unfortunately.
Mhm. And then
So
one
I
more.
have
Oh, go ahead. Go ahead.
no. You can go, Donna.
You sure? Okay. And then this one thing I just want to give you the chance to respond to is that you get it from both ends, and it's in this kind of divided climate here in the state and beyond. Either you're a hero or you're a demon to so many people, in these kind of politicized times. So I guess what I'm curious about there is, how do you cope with being in this kind of hot seat, and then what gives you hope?
I'll have to say that for every sort of nasty comment and even threats of physical violence, there are 20, maybe 30 positive reinforcing comments. And so I think that's really helpful for us to know that, people get it, because people out there get it. It's really sort of like the more extreme folks who buy into some disinformation. Like I said, people sent me some. If I come to their house, they're going to shoot me. I'm not going to go to your house if we're not invited. Why am I going to go to your house? I mean, just think of the logic of that. If you ask me to help you, I will try to help you. That's what our job is. But it's kind of bizarre. And in a way, it's if it weren't so sad, it'd be kind of funny. But I'm just doing my job. What really bothers me is the extra 1,000 or 2,000 people who are going to die from the Delta wave because we weren't where we needed to be, and just ask ourselves, what more could we have done? But as far as people being harsh or critical or unfair, that's such a small price to pay for what we can do to help other folks.
Well, this has been an amazing conversation. I think we got through a lot of the questions, Dr. Dobbs, even though not all of them. So we're going to be trying to follow up to get some more of those answered that readers sent us. We do appreciate your hard work and how you've been so accessible to media and having these conversations. So thank you so much for doing this today. We really appreciate it. I think you said a lot of things that people needed to hear and we'll be talking about. And, and hopefully even other media will be inspired by some of the things that you said about us. So thank you so much for what you do. I know these are very difficult times. We really appreciate it.
No, thank you all. And I appreciate y'all getting good information out there.
Oh, we do everything that we can. So I know it's very difficult times. And to the viewer there, we encourage you to share this program. It's on, as you probably know, it's both on Facebook as well as our YouTube channel. So please get it out there. Share it around. Think about what was said. If there are other questions that you want us to get in front of Dr. Dobbs and his staff, we and our reporters will be more than happy to do that. Just please keep them coming, and we will do everything that we can to get information out there. And we appreciate you guys tuning in today. I always have to say we are a nonprofit media organization, so if you want to stick $1 or $2 in our tip jar to help us keep our reporting going, we appreciate that. We also appreciate all your support to date. On Thursday night, by the way, we do have our regularly scheduled program, which this week is going to be an interview with Rob Hill, who is from Mississippi, and is going to, he's the director of the Human Rights Campaign. So he's going to be talking to Kimberly and me about LGBTQ issues and whatever else that he wants to talk about in the human rights world. And so we really look forward to having Rob here Thursday night at our kind of usual time of 6 p.m. And other than that, please go to the MFP website. We've got lots of stories. Ashton's had maybe 3 stories in the last 2 days that are about COVID, and another one from Nick coming this evening. So we are there. Check out our COVID archives. And thank you again, Dr. Dobbs. We really appreciate you doing this.
No, thank you all so much for having me.
Thank you.